All right, so today we are diving into a really major milestone in medicine. We're talking about the very first FDA-approved therapy for a pretty debilitating rare disease called Recurrent Respiratory Papillomatosis, or RRP for short. You know, for the folks who've been living with this is a moment they've been waiting for decades. And the whole story really starts with a single, staggering number.
Yeah, just take a second and try to imagine that. Going under the knife not once, not twice, but maybe over 100 times in your life. And why? Just so you can breathe, just so you can speak. And look, this isn't some crazy hypothetical scenario. For so many people with RRP, this has been their reality. It's just this constant, exhausting cycle of surgeries to keep the most basic things we take for granted.
So before we get to the actual breakthrough, I think it's really important that we understand the sheer burden of this disease. I mean, the numbers are just staggering, but it's the human cost, right? That's what really drives home why a new approach was so desperately needed.
And this really gets right to the heart of the issue. I mean, think about it for a second. We don't normally treat a chronic infection by just repeatedly cutting out the symptoms, right? No, we go after the underlying cause. But for RRP, the standard of care for so long has just been surgery, literally just removing the growths, all while knowing they're almost certainly going to come back. It's like constantly mowing a weed, but never pulling out the root. You're managing the problem, sure, but you're never, ever solving it.
So RRP is a rare disorder where these benign, meaning non-cancerous, wart-like tumors start growing in the respiratory tract. They're called papillomas. Now, they can technically pop up anywhere in there, but their favorite spot, unfortunately, is the voice box, the larynx, and the vocal cords. And the key word in the whole name is recurrent. It means they just keep coming back. And the impact of these growths, well, it's immediate, and it can be really severe. A hoarse voice is usually the first sign something's wrong, but as these papillomas get bigger, they start blocking the airway. That leads to things like a chronic cough, that noisy, strained breathing you might hear, and in the worst cases, it can become life-threatening. You literally can't get enough air. I mean, it attacks the very essence of how we communicate, how we breathe, how we live.
And here it is. This is the crucial piece of the puzzle, the cause. What's behind all of this? It's a chronic infection with two low-risk types of HPV, specifically types 6 and 11. And yeah, you might recognize those. They're the same types that cause genital warts. For some reason, and we still don't totally get why, the immune systems in these patients just can't seem to kick the virus to the curb. And because the virus sticks around, the papillomas just keep growing back.
And that brings us to the turning point. This is the big news.
On August 14, 2025, the FDA gave its official approval to a new drug. It's called PAPZIMEOS. And let me be clear, this is the first ever immunotherapy. In fact, it's the first ever approved medication of any kind, specifically for adults with RRP. This is a massive deal.
Now, this didn't just happen overnight, not at all. The journey to get this approved was tough, but it was also fast-tracked for a reason. First, it got orphan drug status. That's for rare diseases. Then, and this is a big one, it got breakthrough therapy designation, which basically tells the FDA, hey, pay attention, this could be huge, and speeds up the review. This whole path just goes to show how urgently a new option was needed.
Which leads us to this really fascinating question, right? How in the world does a gene therapy teach your body to fight off a virus it couldn't handle before? Because this isn't about some drug coming in and zapping the virus. No, this is about empowering the body to finally do the job itself. Okay, so let's walk through this process, because it's pretty amazing. Step 1, scientists use a harmless virus as a kind of delivery vehicle. Think of it like a microscopic FedEx truck. Step 2, that package contains the instructions. It's like a wanted poster. It teaches the immune system's T cells exactly what the bad guys, the HPV 6 and 11 antigens, look like. Step 3, the T cells get the message and are activated. And finally, step 4, the attack. These newly trained T cells become this elite search and destroy team, hunting down and taking out the HPV-infected cells that are causing all the trouble. So, if you want to boil it all down to one simple idea, it's this. The drug isn't the weapon, it's the instruction manual. It's a guide that teaches your own immune system how to finally win the fight.